Hello, my name is Professor Zina Moore, and I'm the Chair in Nursing and Head of the School of Nursing and Midwifery and Director of the Skin, Wounds and Trauma Research Centre at the School of Nursing and Midwifery, Royal College of Surgeons in Ireland, University of Medicine and Health Sciences. Since accreditation of the first advanced practice role nationally in 2001, advanced nurse and midwifery practitioner roles have continued to evolve and expand in response to the changing national healthcare landscape and population health requirements. A clear policy framework to support establishment of advanced practice roles now exists, which is responsive to health service need, aligned with professional nursing regulation, national nursing and health policy. The Master's, Postgraduate Diploma and Certificate in Advanced Practice Nursing programmes at RCSI School of Nursing and Midwifery provide innovative and practical frameworks to guide educational and professional development. These programmes offer the opportunity to develop the requisite knowledge and clinical skills for advanced practice roles through a variety of strategies to include reflection, practice experience, clinical, online, face-to-face learning, and clinical simulation. The RCSI School of Nursing and Midwifery advanced practice programmes acknowledge and prioritise mentoring and clinical support to enable each student to realise their full potential in diverse clinical settings across primary, secondary and tertiary care to meet changing population-based health requirements. I really hope that you find this public lecture informative and engaging. Thank you very much.
My name is Thomas Kearns. I'm a Professor of Nursing and I'm the Executive Director of the Faculty of Nursing and Midwifery here at RCSI in Dublin. I'm delighted that we in the faculty, partnering with our colleagues in the school and the leadership of Professor Zina Moore, have presented this year a special webinar in relation to the contribution to advanced nursing and midwifery practice here in Ireland that we in RCSI make. And specifically this year, it's so critically important that we focus on this as we present this year in Dublin the 12th ANMP APN Network Conference. And as a former interim CEO of ICN, I'm really honoured and delighted that this event is coming to Dublin. Critically, from our perspective, as a University of Medicine and Health Sciences, we provide education and training right throughout the lifespan of the profession. And critically, in terms of delivering health policy in Ireland and indeed globally, the impact of advanced nursing and midwifery practitioners have in delivering the critical policy agenda, such as access to high quality, person-centred care, is very clearly evidenced in the literature. And critically, we are joined together as a faculty and a school to present different components of the preparation, the ongoing education, training and professional development of our practitioners. So from our perspective, I was delighted that my colleagues, Professor Mary Carney and Mr. Paul Mahan, were able to demonstrate and articulate the ongoing development that we provide, working with our colleagues in the RCSI hospital group to support our nurse practitioners and our midwifery practitioners and our advanced practitioners in their own ongoing development through the advanced practice network that we've established within the RCSI Hospital Group Centre for Nursing and Midwifery Advancement. So critical to that is that during the candidacy and the post-qualification of our advanced practitioners, we support their ongoing leadership development, their ongoing professional development, their development of clinical audit activity, and of course, critically, the development and support of their clinical research agenda. So these are key components to the ongoing development of the contribution that advanced nurses and advanced midwifery practitioners provide to delivering the health policy agenda for our citizens in Ireland, in Europe and globally. We hope you enjoy the webinar. Thank you.
Hello everybody, you're very welcome to today's event, and thank you for taking the time from your busy schedules to join us. As you may know, the 12th International Council of Nurses Nurse Practitioner Advanced Practice Network Conference, titled Advanced Practice Nursing Shaping the Future of Healthcare, will take place in Dublin from the 21st to the 24th of August. In contribution to this international conference, the School of Nursing and Midwifery and the Faculty of Nursing and Midwifery are hosting this event today to highlight the RCSI contribution to advanced nursing and midwifery practice in Ireland, and a recording of this will be uploaded to the conference platform. Before we start, I want to provide you with an overview of today's event. My name is Dr. Denise Blanchfield and I will be your chair for today. My own background is as an advanced nurse practitioner, providing care for people living with multiple chronic illnesses. I've worked extensively at operational and strategic levels prior to commencing my current role in the RCSI School of Nursing and Midwifery in 2021. A key personal focus has been to raise the profile of the disciplines of nursing and midwifery, highlighting their specific contribution to high quality care experiences and outcomes through publication in peer-reviewed journals such as the Journal of Advanced Nursing. For the purposes of today's event, there will be presentations from Dr. Jarlath Varley from the School of Nursing and Midwifery in the RCSI, and Professor Mary Carney and Mr. Paul Mahan from the Faculty of Nursing and Midwifery in the RCSI. These presentations will be followed by a live question and answer session with our registered advanced nurse and midwifery practitioner expert panel. I'd like to welcome Dr. Patricia Minnick, Ms. Marie O'Shaughnessy and Ms. Claire Kennedy. For attendees, the live question and answer session can be accessed at the bottom right-hand corner of your screen. This will open prior to when the presentations have finished, and you may type in your questions, which will be posed to our expert panel on your behalf by the chair. So what would you like to know about advanced practice nursing and midwifery in Ireland? Time for you to get busy typing. I'd like to introduce our presenters in our expert panel. Our first presenter will be Dr. Jarlath Varley, who is Programme Director for the Advanced Practice Nursing Programmes at the RCSI School of Nursing and Midwifery. Jarlath is also a practising registered advanced nurse practitioner and prescriber, specialising in emergency care nursing. In the past decade, he has contributed extensively to a number of advanced practice projects nationally, including policy development, curriculum design and a national research evaluation of the barriers and facilitators to advanced practice role development and implementation. Currently in his role as Programme Director for Advanced Practice, Jarlath places a strong emphasis on alignment of advanced practice roles to national strategic health policy to promote delivery of high quality, cost effective and safe person-centred care. Our second presentation will come from Professor Mary Carney, and Mary is currently Director of the ANMP Forum, the RCSI Hospital Group in the Faculty of Nursing and Midwifery. Mary is a registered nurse and midwife who has graduated from UCD with a PhD, MBA and nurse teaching diploma, and is a fellow of the Faculty of Nursing and Midwifery in the RCSI. Marie was previously head of School of Nursing, Midwifery and Health Systems UCD, and in 2008 was appointed Associate Professor and Director of the ANMP programme in the School of Nursing and Midwifery. Mary has served as RCSI Dean of Faculty of Nursing and Midwifery and as a visiting professor to several European universities with published research in international journals. Our final presentation will come from Mr. Paul Mahan, and Paul is the operational lead for the Centre of Nursing and Midwifery for the RCSI Hospital Group. His background is in neurosciences and nurse education. Our expert panel is comprised of Claire Kennedy, who is a registered advanced midwifery practitioner and who is currently seconded to the National Women's and Infants Health Programme, ANMP, as project coordinator for the HSE Baby Friendly Initiative. The focus of Claire's current role in ANMP is to support the implementation of the Health Service Executive National Standards for infant feeding in the 19 maternity services and units nationally. Dr. Patricia Minnick is an advanced nurse practitioner in rheumatology since 2003 in the Rheumatic Musculoskeletal Disease Unit, Our Lady's Hospice in Harold's Cross. Patricia was the first ANP appointed to the area of chronic disease. She works with a young adult population and those requiring complex case management. Fatigue as a patient-centred outcome in inflammatory arthritis was the subject of her PhD study, and she is the first author of 9 peer-reviewed publications. Patricia works in partnership with UCD, contributes to national healthcare policy, and is a member of the board of the Faculty of Nursing and Midwifery at RCSI. And finally, Maria O'Shaughnessy is a registered advanced nurse practitioner in tissue viability and wound management. She is currently employed in an integrated role between Community Health Organisation 1, which covers a diverse area of Sligo, Limerick, Leitrim, West Cavan, apologies Marie, and vascular services in Roscommon University Hospital. Her advanced practice skill set lies in endogenous ablation for lower limb venous disease. Marie continues to provide clinical and professional supervision and mentorship to a wide variety of healthcare professionals, including clinical nurse specialists and candidate ANP. I would now like to welcome our first presentation from Dr. Jarlath Varley, School of Nursing and Midwifery, RCSI.
So thank you very much, Denise, for that, and a big welcome to all of you for joining us at this public lecture, which explores RCSI's contribution to advanced nursing and midwifery practice in Ireland. My name, as Denise said, is Jarlath Varley, and I'm Programme Director for the Advanced Practice Nursing Programmes here at RCSI. I have been, I suppose, around and involved with nursing practice since the mid-1980s, which is a long time ago, over 35 years ago. But in that time, healthcare, of course, has seen a dramatic shift in society and in our world, and no more so than at the moment as we live through the pandemic. And yet for all those changes and for all those challenges, many of the core values and principles of nursing and indeed advanced nursing practice remain very much the same. So in early 2020, I joined RCSI School of Nursing with responsibility with implementing the advanced practice nursing programs that you see listed on the right-hand side there. And these programs had been accredited earlier in 2020 by NIMBY. Assisted by the head of school, Professor Zena Moore, and the wider school team or the nursing team at the School of Nursing, our first cohort of advanced practice nurses commenced in September 2020, with students active on each of the 4 programs available. These students have just completed year 2 of their programs and will be graduating hopefully later this summer. So, having worked as a nurse and in advanced nursing practice for the last couple of decades, in those years, one thing that I can say for certain is that each nurse's journey is similar, but always a different experience for each individual nurse. And indeed, I think more so now, a different experience, but similar for the services that are supporting the development of such roles as advanced practice. And while the journey and experience is challenging, there is clear and explicit guidance available for nurses from the likes of NIMBY that guides students of advanced practice to clear pathways of registration. For example, on the left-hand side there, Pathway 1 and Pathway 2 as laid down by NIMBY. And again, while the journeys have always been challenging, we have learned a lot over the last 20 years in Ireland of how to implement the ecosystem that best supports and develops advanced nurse practitioners and advanced midwife practitioners to develop these roles. Whether that be policy on role development from the Chief Nursing Office and the Department of Health, standards and requirements as laid down by NIMBY, and operational guidance from services such as the OMNSD and NMPDU. But even, of course, with all that support and resourcing availability, the role and scope of practice, its definition, and its successful implementation can still be challenging. And in some respects, I actually find that at times for a lot of people, it's confusing. And this can often lead to a sense of isolation and the phrase professional loneliness, as the individual student or indeed the individual service struggles to activate and maintain forward momentum in developing a role or scope of practice. So I often pose that question, in essence, how does an individual or an individual service know that they're on the right path in the first place? And it's critical to think about this because the success of the role and the scope of practice is dependent on finding the right path, getting on the right path, and keeping yourself on the right path in the future. And to do this means that the practitioners reap the professional rewards of the job. And for me, that one of the high-ranking positive outcomes of advanced practice is high levels of job satisfaction that comes with the scope and the advanced practice skills. So obviously, if the nurse practitioner is developing that way, the organisation is delivering better and safe care, and ultimately patients will have better healthcare experiences and no doubt clinical outcomes. So sometimes I think of this, we use often the term all, so when we're talking about these type of initiatives, so who are we talking about when we're talking about all or everybody? So it's all about these groups, of course. It's patients, families, carers, all types of carers, people who care for as part of the role and professional job, and carers who care for extended family members, care providers, policymakers, regulatory bodies, communities, societies, and I suppose what I mean is you and me, because tomorrow's patient is today's healthcare provider. It's all of us. And we all have a vested interest in making sure or ensuring roles such as advanced practice or advanced practitioners are meaningful and are implemented in a way in which optimum use of that resource becomes available to the patients that it cares for. So, of course, adding to all of this is the complexity of the 21st century healthcare system. And I suppose if you stand still sometimes and think about that, it can be quite dizzying. And this is true, of course, for nurses and indeed for the wider healthcare service. Next slide. And sorry, did you next? Oh yeah, sorry, thank you. It's imperative, of course, that students or candidates of advanced practice, be they nurses or midwives, that they're not born into silos, which create an unrecognized culture of working in isolation, which impacts overall on the quality and equity of services that potentially are being provided. Collectively, we must place our emphasis on structuring and optimizing care strategy and care pathways, be that for patients, families, and society in general. And I suppose advanced practice nursing is part of the reconfiguration and solution, but it cannot operate in isolation because this creates disparity and inequality right across the service. So here at the RCSI School of Nursing and Midwifery, we give very equal weighting to both of these elements of advanced practice training and development, clinical competency attainment, and understanding strategic and operational alignment to national healthcare policy. To maximize the impact and effect of ANP or ANP roles, they must be scoped out and aligned with integrated national healthcare policy at all times. So also there's or not also, I suppose, and we know that there's lots of policy out there now, there's lots of strategy, and there's lots of national programs to guide service development and ensure that we maximize the impact and the availability of the resources for everybody, including the advanced practitioners in nursing and midwifery. So this equal weighting is, I suppose, is really reflected in the professional diversity of the group of students that we had last year and that we have this year on our programs. Currently, we have students of advanced practice from primary care, community care, mental health services, hospital-based care, integrated care programs, and clinical care programs. And that's important because without that, if we don't do that, if we focus or concentrate only on clinical competency attainment, then there's a trick or a significant trick missed in the context of the professional development of the ANP role, and that's the strategic and operational alignment to national healthcare policy agenda of these roles and scope of practice. Next slide, thank you very much. So that takes me to the end of my presentation. I would just like to, first of all, just to thank Denise. And just to say, if anybody out there that's listening to today's presentation or is playing this back later, would like to get further information about pursuing a role as an advanced nurse practitioner, or indeed a manager who is maybe listening to this and is considering developing a role or a scope of practice and advanced practice within their service, we're always free, myself or any of the team, to answer your questions. And we can be contacted through this link, and or we can be contacted by email or telephone. So thank you again for joining with me today, and I'm going to hand you back to Denise now.
Thank you for that introduction, Jarlath, and it gives me great pleasure now to introduce our next presenter, Professor Mary Carney from the Faculty of Nursing and Midwifery in the RCSI. You're very welcome, Mary.
Thank you. Well, you're all very welcome. Thank you for joining us today. I will talk to you today about the Advanced Nurse and Midwife Practice Forum, and I will be joined later on by my colleague, Paul Mahan. The Advanced Nurse and Midwife Practice Forum, titled the ANMP Forum, RCSI Hospital Network Group, was launched on the 25th of October 2018 in the Faculty of Nursing and Midwifery by Dr. Anne-Marie Ryan, Deputy Chief Nurse in the Department of Health. Dr. Ryan spoke on policy perspectives, and Ms. Joanna Bryan, a registered advanced nurse practitioner in Beaumont Hospital, spoke on ANP perspectives about the network. Representatives from Beaumont and Connolly Hospital, from Nursing and Midwifery Planning and Development Departments, and advanced nurse and midwife practitioners attended the launch. The forum was set up from findings from a survey of advanced nurse and midwife practitioner needs that was undertaken by Professor Thomas Kearns, Executive Director, Faculty of Nursing and Midwifery, Miss Karen Green, Director of Nursing, and Miss Patrina Donnelly, Assistant Director of Nursing in Beaumont Hospital at that time. I was appointed coordinator of the ANMP Network Forum. Following this, I visited ANMPs in the forum to determine their education and research needs, and I've kept in regular contact since then. The aims of the forum are to support advanced practitioners in keeping up to date with practice, education and professional development, to provide a forum for discussion and act as a conduit for interactions between ANMPs. The forum also addresses some of the educational and academic needs of advanced practitioners. The forum aims are being achieved in several ways. By keeping ANPs up to date with regulation, standards, requirements, and published documents. By providing updates on innovative advanced practice in other countries where advanced practice is well developed. By providing educational supports through up-to-date national and international journal articles relating to advanced nurse and midwife, education, research and clinical developments. By receiving support from RCSI librarians, and this support includes research obtained through weekly EBCO briefings on published research. ANPs are supported by the forum coordinator in several ways. This support includes information on the Faculty Education and Research Conference, invites to biannual seminars and webinars, and by facilitating small group meetings for interaction, discussion on new research, and for informational purposes. As forum coordinator, I research and write a forum newsletter every 2 to 3 months that contains up-to-date research findings. I support ANMPs in their current research and provide academic support for their research work that they are interested in developing further, for example, in the areas of fractures, falls, or cardiac. Professional networking links within the RCSI network are fostered. So ANPs are supported by the forum coordinator in facilitating research and innovative developments, including communication with other services in the RCSI network, for example, in primary care, mental health, cardiology, maternity, emergency, or minor injuries, and by collaboration with European and American universities via video conference on advanced nurse and midwife practice. There are challenges. Yes, there are challenges faced by ANMPs. And these challenges were discussed in the forum. 3 seminars took place to identify ANMP responses to the forum, and these took place in Beaumont and in RCSI. And whilst the discussions were mainly positive, several challenges to the role were identified and discussed. The main challenges that participants believed could hinder safe and timely practice are the need for dedicated time for research and publication. Lack of dedicated time, in their opinion, was resulting in their inability to research the role and develop evidence-based practice as much as they would like to do. Whilst acknowledging that they received ongoing support from their Director of Nursing and Director of Midwifery, they would like to receive more support for dedicated research time. More dedicated support from their organisation was also needed. Participants acknowledged that their roles and responsibilities and their level of autonomy were mainly within their own domain, but they needed more support from their organisations to develop the role even further. ANPs also reported challenges to gathering data specifics to the role and to patient metrics. Greater administrative assistance would be much appreciated. So, what were the challenges faced by ANPs? Also, they identified during these seminars the need for enhanced recognition of the advanced practice role by having their workload recognised and accepted by the multidisciplinary group members. They identified the need for autonomy within their scope of practice, and while recognising that all ANMPs report to a consultant or to a relevant ANMP and to the Director of Nursing or designate, there is a recognised level of autonomy that needs to be accepted by senior managers in the organisation. Further development of medication prescribing, including X-rays, was also identified. So, how does the ANMP Forum support advanced nursing practice? Well, the Forum contributes to and supports advanced nurse and midwife practice, and by doing this, shapes the future of advanced practice. The Forum is also innovative, as it's the first ANMP Forum established in Ireland. ANP have told us that advanced nurse and midwife practitioners contribute to enhanced practice, thus providing excellence in patient care delivery, and research bears this out. ANPs also believe that receiving specific research education and clinical practice information through research-focused newsletters enhanced their knowledge. A Centre for Advanced Nursing and Midwifery Practice was developed in 2021 in the Faculty of Nursing and RCSI to further enhance and advance nursing practice, and the ANMP Forum members sit within this centre as key research and education contributors. It is envisaged that nursing grand rounds, recently introduced in Beaumont Hospital by ANMPs and CNSs, will further support enhanced practice. My colleague, Paul Mahon, will now tell you about the centre.
Many thanks for that insight into the forum, Mary, and it might prove very helpful for some of our attendees who may be considering setting up their own forum. So many thanks for that. I'd now like to welcome Mr. Paul Mahon for his presentation from the Faculty of Nursing and Midwifery. You're very welcome, Paul.
Many thanks, Denise, and good afternoon, colleagues. I'm delighted to join you this afternoon to tell you just a little bit about our Centre for Nursing and Midwifery advancement. So nurses and midwives comprise over half the healthcare workforce globally. Indeed, oftentimes the only health professional a person may see is a nurse or a midwife. And I know I'm speaking to the converted when we say nurses and midwives are a vital resource for health, and we must be invested in, used wisely, and enabled to practice to the full extent of our education and training. And certainly continued education and professional development play key roles in building the knowledge, the skills, and the attitudes needed for the modern healthcare setting. So in pursuance of its mission to educate, nurture and discover for the benefit of human health, and aligned to our values of respect, scholarship, collaboration and innovation, in 2019 the faculty began establishing the Centre for Nursing and Midwifery Advancement for the RCSI Hospital Group. As I said, this presentation will just give you a very brief overview to the development of the centre. So in September 2019, the Faculty Board accepted a proposal by our Executive Director, Professor Kearns, to develop the centre. A steering group was established and Professor Carney, who you've just heard from, was appointed to undertake a detailed scoping exercise involving a number of focus groups and interviews with over 90 staff across the hospital group and indeed our partner services. And this steering group agreed that the centre would coordinate and collaborate across the hospital group, sharing work across clinical practice, practice development, research, education and leadership. But unfortunately, as with everything across the health service, the outbreak of the COVID pandemic delayed the appointment of a centre lead, and this was eventually completed in January 2021. So based on the results of the scope and review, Professor Carney had proposed 4 core competencies for the centre to be a focus on engagement, retention, recognition and reward, and continued development of nurses and midwives at all levels. And while each core competency focuses on individual component of the overall vision for the centre, they're obviously all interlinked, with success in one area translating to success in other areas. And within those 4 core competencies, there was 44 individual areas for action. So the next step was to conduct a survey of senior nurse and midwife leaders across the group to identify the areas of highest importance and highest priority. So in terms of the individual items, areas with the highest priority and importance were identified as starting points for the work of the centre, namely supporting recruitment and retention, continuing the advanced practice forum, scoping the development of specialist forums, supporting innovation, clinical research and publication, graduate transition to practice, and expanding competence and capability. So some examples of the work to date. Well, in terms of supporting professional growth and development, one of the key actions has been the implementation of the Hospital Group Nursing Now Challenge. And this programme aims to develop leadership competency across the group. Participants have had input across the 5 study days from some of the top nursing and midwifery leaders locally and globally, including Ms. Elizabeth Iro of WHO and Professor Rick Riccardi of Sigma. Another key action was the establishment of the DAISY Awards. DAISY Awards recognise extraordinary compassion and care, and how they work is nominations are received from relatives, from patients and colleagues who detail why the nurse or midwife should be recognised. And some of the stories of extraordinary compassion, especially over the course of the pandemic, are testament to the centrality of the nurse and midwife in the care of people we serve. Of course, much of the work is across those 4 competency areas, and some examples here include collaborating with our Centre for Research Excellence, working with the Group Chief Director of Nursing and Midwifery in relation to strategy, working with external partners including the Mental Health Commission and Dublin Simon community, and collaborating with international colleagues on European projects. And then in terms of contributing to policy and recruitment, the Centre has also published as part of the World Innovation Summit on Health, Future of Nursing collection. So the impact of nurses and midwives in society has never been more evident than during the COVID pandemic. And as I mentioned at the start of this very brief overview, the need to invest in the further education and development of nurses and midwives has equally never been more evident. An initiative such as the Centre for Advancement can help support professional development, and I hope this very brief introduction has given you a flavour of some of its work. Thank you.
Many thanks for that informative overview, Paul. I'm sure it'll be very useful for some of our attendees joining today. I'd now like to open the question and answer session. It's now open. If anybody would like to type in a question, I'll be happy to pose it to the panel for you. Our first question we will pose to Ms. Claire Kennedy. Okay, our first question really is, Claire, what are the main challenges you encountered in the establishment of a new registered advanced midwifery practitioner role and service? What do you think were your main challenges?
So I suppose when I started out in my candidacy, I was the first registered ANP to proceed into this role in our unit. Other advanced nurse practitioners had gone before and were established. So this was a completely new role. So a lot of change management had to come into play for integrating this role into an already established service. We had to establish our steering group. We had to have multidisciplinary team involvement, both from the hospital acute and the community-based services. We had to do numerous education sessions with our colleagues in St. Luke's and Kilkenny, as again, this was a new role, so we had to bring people along with us as we integrated into services. There was a lot of policy development, SLA documentation, and again, running through kind of different integration and establishment processes. Again, linking in with our colleagues in the community was a new step forward for us in maternity services. So that would have been our colleagues in public health nursing, GP practice, etc. So taking part in some of their form and education sessions were fantastic as well. I would also say the support I got from my established colleagues and advanced nurse practitioners in St. Luke's was so helpful in this whole process, and also my ANMP colleagues nationally here in Ireland and our project officer from an NPDU definitely assisted in those challenges that I met through the process.
Many thanks for that, Claire. I think it really highlights the journey of advanced practice, in that, you know, often the template isn't there to follow, and that in itself is a component of development of AN and ANP competency development, that you have to find the way. But you also learn the skills of collaboration and political entrepreneurship as well. And at the end of the journey of establishment of both yourself in the competency development and also your service, you know, the skill set is completely diverse compared to probably where you start on the journey of advanced practice. So that's very informative. Thanks very much, Claire. Our next question will direct to Marie O'Shaughnessy.
Hi, Denise.
Okay, so the question, Marie, is how did you develop a vision for your own advanced practice role and service?
Well, firstly, I worked as a clinical nurse specialist in tissue viability and wound management for many years in the community. And at that time, I had a large caseload of lower limb ulcers that were remaining unhealed or reoccurring within a short period of time of healing. That obviously posed a clinical challenge for both the patient and for the health service in terms of frequency of healthcare contacts and also a high attendance of these patients in A&E with repeated infection. So I guess I had to look at ways of how I could improve or increase healing rates within the community. At that time, we had a new consultant was in Galway University Hospital with an expressed interest in lower limb venous ulcers. So I approached him and started working with him shortly afterwards. It soon became apparent that there was a role for an ANP warranted, particularly around assessment, diagnostics and treatment of lower limb ulcers. And therein really began my advanced practice journey.
Okay, thanks for that, Marie. I think what stands out there really is that, you know, the establishment of the role and service was really driven by patient need, and, you know, that, you know, patients were having probably deleterious negative outcomes from the fact that they didn't have earlier intervention. But also what stands out there is the requirement for champions for advanced practice that fall outside the discipline of nursing and midwifery, that they are also, that support at organisational level is also required. Okay, and Patricia, we might ask your good self the next question. Patricia, you set the trail for chronic illness management, and many of us followed in your footsteps after, because when the post started initially, they were very much based in emergency departments, and the area of chronic illness has become a national health priority, especially with the planned implementation of sláinte care. As the first ANP in chronic disease, from your perspective, can you highlight the scope for advanced practice nursing to bring healthcare to all with chronic disease?
Yeah, well, I'd like to start by making a very bold statement, really, that a career in chronic disease nursing is very rewarding, and it's almost something that deserves to be put, or needs to be put, in neon lights, I think. And my reason for that statement is that I guess if you think about it, none of us really entered into nursing to develop a career in chronic disease. I think we probably all enter to save lives, and we didn't really know how we were going to do that. And it's fair to say I'm still coming across that in the student nurses that we come across when there's been time with myself and my ANP colleagues. They're sort of, wow, I didn't appreciate that role, never thought about that, and yet you ask them where they're going next, and they're moving to CCU and ICU and A&E and the saving lives arenas. So I think there's work for us to do with our undergraduate nurses to begin to create career options, to sow that seed that there's great options for nursing, for nurses in chronic disease care. Unfortunately, I still think our chronic disease patients are seen, if we draw an analogy with other services, they're the repeat offenders of the revolving door patients, and often, don't necessarily get the early recognition that that they deserve, or more especially that the scope there is for nursing and working with patients with chronic disease. As the State of the World's Nursing Report 2020 highlights, that nurses are critical to the delivering on the promise of health for all and leaving no one behind. And I think, that really, to me, that sort of verbalizes very much how I feel about chronic disease. And, in that same document, we highlight the need for nurses in order to deliver universal health care, mental health, again, to a marginalized group, patients with chronic disease who are not so well recognized as our patients, maybe with more acute or surgical needs. But, and that's the global perspective. And then nationally, we have our graduate to advanced practice policy that also sets the stage and framework for us to develop nursing further, and nursing career options in chronic disease. Again, earlier, I think, in the career of nursing, as early as in undergraduate level, we should be sowing that seed very well. Our graduate to advanced practice policy states that advanced practice is, to deliver patient and service needs across the life cycle, and to care for all age groups, to address population health, deliver sláinte care, to allow nurses to work to our max of our license, etc. And I know, there's an awareness of chronic disease, but I want to give a shout out here today for the Cinderella chronic diseases. When we speak about chronic disease, and our documents, our global and national documents indeed reflect this. The diseases that are named are cardiovascular disease, diabetes mellitus, cancer now, which has become a chronic disease, respiratory conditions. There are a whole plethora of chronic diseases, like rheumatology is my biased and chosen area, but there's also dermatology, there's gastroenterology, there are chronic diseases in neurology and lots of other specialties that are not so well recognized, therefore not funded, and therefore not even thought about as career options for our nurses. And nursing as a career is very, very rewarding in chronic disease. It's the one area where you can really live case management with your patients, and there's huge scope for autonomy in case managing your patient caseloads. It's essential that your in chronic disease, that you work with the multidisciplinary team and engage in interdisciplinary care if you are to be an effective case manager. So therefore, there's need also for integrated care and liaising with people in community and across services, acute and primary. Chronic disease nursing is cradle to the grave in lots of cases, and it's about preventative healthcare and disease prevention. And at one stage it's about vaccination, at another stage it's about health screening. So it's never stationary. There's a constant demand on you as a nurse to expand your skills and your scope and your license indeed, to maintain your skills for health promotion and delivery of healthcare in the primary community setting, and indeed great demand to usually develop education for these small niche areas and market your area and create that career. So this is, currently I'm working where the early steps, I guess, with dermatology and gastroenterology colleagues to try and raise awareness of these more Cinderella areas where our patients are not named within the larger documents. However, all our patients will end up with cardiovascular disease, cancer. They have the same risk factors. In fact, because of the background nature of autoimmune inflammation driving most chronic diseases, the Cinderella chronic disease patients end up with the more common chronic disease at a higher sort of level and than the general population. So this is, you gave me an opportunity there, Denise, to wave my flag very high for the, I hope, and loud, for the chronic disease nursing as a very rewarding career for nurses, for nursing to deliver healthcare across the spectrum, across the life spectrum, across all health delivery areas, whether that be acute or chronic. And I think at this point in nursing and the development of clinical and advanced practice nursing, there is just huge scope, and you're only limited by your imagination, really. And yeah, I hope that answers the question, Denise.
Yes, you flew the flag royally there, Patricia, and well done. Coming from a chronic illness management background myself, I completely understand the points you're making. I think probably the policy direction has changed to support chronic disease management, and many of the services involved in Ireland in response to problems at local level, whereas with Sláinte Care and the emphasis on chronic disease and the diversity of chronic disease. And as you say, you know, certainly in clinical practice, people don't come in with one chronic disease, and most people over 65 have at least 2 chronic diseases, and that it needs the diversity of the care that you can provide and the relationship you have with the patient is really, really rewarding. So definitely, you know, I think chronic illness management is a key focus of the current advanced practice cohorts on our programmes. We have a lot of our students who are based in community and primary care settings, and their main day-to-day will be chronic illness, a diverse chronic illness management cohort. So thanks very much, Patricia. Our next question to Claire. Can you hear us okay there, Claire?
Yeah.
Okay, Claire. You know, some of the questions coming into the forum are asking what would differentiate a registered advanced midwifery practitioner from, say, other senior nursing roles, from, say, a senior midwife, CMS or CMM?
Yeah, so I suppose, again, when I started into my advanced practice journey at the time in Ireland, there was only 7 ANPs nationally here registered with NMBI, which is quite few at the time. We were not as established as our counterparts in nursing. And there was a lot of confusion at the time and lack of awareness around the role, exactly where the role would integrate into services already established. And I suppose traditionally services, maternity services, have been provided in the Republic of Ireland by obstetricians as the lead clinician. So this was a completely new role which hadn't integrated into services previously. One of the most common questions I could have been asked early in my career is what differentiates me. So I suppose how I would have educated around that was presentations similar to today's. I would have had numerous site visits from other candidate ANPs once I registered, having student involvement, presenting to the multidisciplinary team, the clinical governance within our unit as well. And I think one of the key factors to differentiate was in-service practice, so demonstrating how we assess, plan, implement, retain or discharge from our services, and how that key decision-making capacity differentiates us in our practice. And also I think it has to be then established and backed up with our data and our annual outcomes and our KPIs to demonstrate exactly how we service improve. And I think as well, taking on board the service user. So within our service, that would be the woman, taking on board the service user feedback and using that in our annual reports as well. That's not just quantitative data, that we're also taking feedback, so that can further service develop. So I suppose the role I initially started with and where I finished had changed over time to meet the service needs of the woman attending, which, you know, again, shows that we can be very adaptive to what our service users need in our roles. But that would have been my key way of demonstrating how an ANP differentiates between the other roles in midwifery services.
I think it's clear there, Claire, that, you know, the level of clinical decision making and autonomy had to be, you know, understood by all team members. And part of your role in the establishment of the role in service was actually, it's not to differentiate between the different roles, but to actually, you know, to highlight how the advanced midwifery practitioner role both, you know, adds to and is different from other nursing or midwifery roles, and that, you know, it's all for the benefit of the patient at the end of the day, irrespective of the role or title. So, you know, it's very useful for people to understand that they, you know, they do work as a member of a team and as an organisation, and at the centre of it is, you know, the KPIs, the patient outcomes, but also the patient experience. And, you know, as a leader in a service, the advanced nurse and midwifery practitioners, that is part of their role to actually foster that culture of continuous improvement, but also involve, you know, aligning services to meet the expectations of both the provider and the participant in care. So thanks for that, Claire. Marie, we have a question for you on integrated care. So how can you outline how the integrated ANP role, such as yours, meet the Sláinte Care programme objectives?
Well, firstly, Denise, my ANP role spans across primary and secondary care. And as I move during the course of my work across both services, the care is delivered in the most appropriate setting. For example, sometimes patients may need a visit to the acute vascular services for a procedure, but all pre and post procedure care and follow-up happens in the community, and that results in a reduction in footfall in the acute hospital. By my role being movable, if you like, it also facilitates quicker access to the vascular acute services, as often the patient is first seen or picked up by a healthcare professional in the primary care. We have transformed how we deliver a specialised lower limb vascular services, and in doing so, we deliver the right care in the right place and at the right time. We ultimately have moved the majority of lower limb vascular care out of the acute hospital and into the community setting, which is obviously closer to the patient's home. An evaluation of the model of care to date has positively impacted on reducing hospital admissions, reducing length of stay of those hospital admissions, and obviously reduced cost in inpatient admissions. So I think all those factors positively reflect how we meet the Sláinte Care objectives.
Yeah, I think you've put it in a nutshell there, really, Marie, because you've touched on, you know, right care at the right time by the right person to the right people, and that in essence is Sláinte Care operationalised across primary and secondary care interfaces, and that is in essence what your role does on a day-to-day basis. I mean, the diversity of the area that you cover, but also across primary and secondary care interfaces, and, you know, your role in mentorship in your region for candidate and CNS, you know, ANPs, that is also a component of Sláinte Care, in the fact that the right people are providing the right care in the right place at the right time. So thanks for that, Marie.
Okay.
Patricia, we might ask you to outline some of the practice-based initiatives established or in various stages of development, which might inspire replication in other disease areas. So would you like to talk to that?
Yeah, thanks, Denise. Yeah, rheumatology was very fortunate with the development of the launch of the new policy for advanced practice, and new rheumatology ANP posts were appointed, or ANPs were appointed to posts, and we have 25 advanced nurse practitioners in total in position in Ireland, which in rheumatology, which is wonderful. Most of these posts came into most of these post holders came into had completed their education, took up the post in 2019, and around the corner we all know what happened with the pandemic. Just sort of knocked them all off their pedestal, if you like, really, with their great plans for implementing their great work. And so we're really just getting back on track in that sense. But there's some I just like to refer to. That I'd like to talk about. One, I'm going to refer to a colleague, Louise Murphy, down in Cork, who has managed to establish what we call a treat-to-target approach to patient management in a community setting. Again, most of the rheumatology ANPs at this time point are hospital based, and we know the challenge to implement sláinte care and to become more community based, etc. So and with that in mind, Louise is trailblazing for us down there, where she has working with the primary care development officer, and they've secured a location for her in the community linked to Cork University Hospital, where she'll be looking after a cohort of patients in the community setting, which is wonderful. And that's something for, I know there are others just at her heels or chomping at the bit to sort of replicate that now that we're, well, it's hard to say I suppose we're back to a new normal, and we have to get on with living in the situation we're in. Coming more close to home, I work in rheumatology, which is based at Our Lady's Hospice and Care Services in Harold's Cross, and we were, when I started there, for residential inpatient service for patients with autoimmune rheumatic diseases. And that has evolved, and of course it rapidly evolved, I should say, during the pandemic, and now we're largely an outpatient. In fact, it was my own advanced practice development that developed an outpatient service there to start with, and now we're largely an outpatient service with less emphasis on inpatient admission, which again reflects advancement in treatments, etc. And working with myself there in Harold's Cross, I have a colleague, Louise Moore, who's developed a reproductive health pathway for patients with autoimmune inflammatory diseases. And this came out of Louise's MSc study and the desire to develop advanced practice, and now it is a pathway she trailblazed, which is firmly established with Our Lady's Hospice and Care Services, which is part of the St. Vincent's University Hospital Service for rheumatology, and the National Maternity Hospital, and that is bringing reproductive health to ladies, to women, to families with autoimmune inflammatory conditions that require biologic medications to manage these diseases and to maintain their health during pregnancy. So that is a great practice development initiative that was led by Louise, and is now sort of being replicated all over the country, and which is good to say. I guess up to that, reproductive health was sort of, you need to come off your medications if you're to have a baby, and in fact the reverse is the situation. We need to get disease under excellent control before recommending a pregnancy planning to patients, and Louise would have trailblazed with that as part of the service for patients with chronic autoimmune diseases. So we have, just evolving out of Harold's Cross, is a fibromyalgia self-management program, which is for patients with that chronic pain condition. And there's a colleague of ours at CNS level has developed this pathway, which is nurse-led and community-based, and to bring healthcare to patients with this chronic pain condition in a self-management way, which is initially hospital linked, but moving the patients into the community with for self-management.
I think what it highlights is
Yeah.
that, you know, that advanced practice roles and services are never static, and
Yeah.
that, you know, that you're leading as nurse
Yeah.
and midwifery practitioners in the evolution of services to meet client need. And whereas in like, say, for example, if you take the use of biologicals in the pregnant population, I mean, how they, you know, your input and evolution of that service has impacted on people's life choices. And I think, you know, it gives a real insight into the fact that when a role and the service are established, they're never static. They continue to evolve to meet client and service needs. So thanks very much for that.
Well, I might just add, my brain has kicked into function again there, Denise, if you don't mind. Another sort of, I guess, kind of almost nearly marginalised group, and it's come very much to the fore, as that this group are being very well managed now by nursing, not just in Ireland, but in the UK. And that is patients with gout, which is a very painful condition. And again, one of my colleagues has developed a care pathway for patients with gout that is bridging between hospital services, where the patients often turn up in acute, very distressed state, and are unfortunately mismanaged because of lack of understanding how best to manage. And my colleague Madeleine is leading in that care pathway between hospital and community, where these patients are being in a treat to target manner, and then they're being successfully discharged in remission into the community. So these are all pathways, probably still, you know, in the early stages of development. A lot more to pandemic, as we all know, has sort of put a bit of a kibosh on everybody's progress, but these are these are sort of good initiatives that are established, and there's more dividend to be paid by the maintenance of these programs at advanced practice level. And I think that the dedication, or the case management of nursing in the management of these challenging, painful conditions is paying the dividend, if you like, in keeping these patients in the community and out of the acute setting.
Thanks very much for that, Patricia. And as we come to the end of today, I would like to say a few thank yous. I would like to thank you all for attending, to our presenters, Jarlath, Marie and Paul, for your insights and expertise, to our expert professional and clinical leaders, Marie, Patricia and Claire, for sharing your knowledge and expertise. Additionally, to Professor Zena Moore and Professor Thomas Cairns for your support in making today possible. Finally, a sincere thanks to the Irish Association of Advanced Nurse and Midwifery Practitioner Association and the Irish Nurses and Midwife Association for this opportunity, and to the RCSI School of Nursing and Midwifery Information Technologist, Mr. Frank Park, who was hugely valuable in assisting us today, Communications Manager, Jane Butler, Claire Phelan from Conference and Events, and Tony from the design team, from all their assistants. Thank you all very much for attending today, folks, and I hope you found today's event enjoyable.